Good evening, Tracy. Thank you so much for joining us. You know, so many people are finding themselves doing different things during this lockdown to meet the most pressing needs. Tell us what you normally do and what you're doing currently to help people in distress.
Thanks, Sally. We work in early childhood development with the age cohort from 0 to 6 years old and pregnant mothers. And normally we provide an essential package of services to these young children that are critical for their holistic development. So they include nutrition, early stimulation, social services, health services, and support for parenting. And we work across 9 different communities, including Langa, Lavender Hill, Gugulethu, Khayelitsha, as well as Lavender Hill and Saldanha Bay. And we reach approximately 3,000 children. So also we work with ECD centers and across 12 different communities, and there are approximately 20,000 children. And so our ordinary work includes food distribution, but we have activities for children in their homes on a daily basis through our field workers, where they are stimulated and we engage with all aspects of their development, because we find that normally by school-going age, these children are 2 years behind because they haven't had any access to any proper ECD services. So we intervene, and normally with our programs, they're able to actually get into school quite ready to take up formal schooling.
So it's really an important need that you are already filling. And now, are you seeing that in those communities that you know so well, that you're already operating in, is there a growing need? Is it tangible, Tracy?
Yes, it's actually very, very tangible, and it's changed. So we've converted our normal operations to respond to the needs that have come out of since the onset of COVID-19. And food distribution, the need for that is escalated. Our communities are ordinarily resilient and quite resourceful, and often do extra activities or to earn extra income. Many of these income sources have now been cut off. And in the past, we distributed over 800,000 meals in the past 8 months through partners such as Rise Against Hunger, JAM South Africa, RCL Foundation, or the Dumo Foundation, and so we find that the need is now escalated. More people require support because they don't have access to the income that they ordinarily would have, and the income grant is just not sufficient to cover the needs.
So, Tracy, you're starting to provide more food than just, you know, as you said, nutrition's already been part of the sort of early learning support, but there's so many other things, and food is the most pressing need. The COVID-19 fund that eMedia is now running in conjunction with the HCI Foundation, which I know supports what you do, has raised 4.3 million rand. That's going to have a real impact, and it's really going to help what you do, isn't it?
It would have a major impact, because we've looked at 3 critical things. The first would be the food distribution, which has to continue and has to be increased. The second one is that there's a lot happening in our communities, but what's not happening is that the information and communication is not getting through to the communities. And so most of our families are not aware of what they can access. They're not aware of the protective measures that they need to put in place. They're not aware of a lot of the things around COVID-19 at the moment, and we're getting a lot of requests for information. And and also the information is in English, and many of our communities can't read in English. So I think maybe, you know, there's a reason why a lot of the communities aren't adhering to a number of restrictions, because we have basic questions such as, what can we do? Can we go out and buy food? Can we go to the clinics? And can we play outside? So those are the questions that we're constantly getting through our field workers, and we're finding that the information is critical. There may also be the supportive mechanisms in place in communities, but people are not aware of how to access and who to call. So we actually need to get more information through, and that's one of the things we've been working on, is to put together a database of information that our workers can access, because our field workers do have some of that information in place, but more is needed.
Yes.
Because outside of the food, the safety nets that children normally enjoy still need to be maintained, because we find that there's emergency food relief, and that used to be supplied before, and suddenly people feel they can't access it. Our clinics may not be as accessible as it was in the past. People fear, for instance, that if their children are sick, they'll be taken away to hospital without their parents being able to go along with them. So these are all the fears and concerns that our communities have, and we're simply not giving them the information that they need.
Tracy, such a great thing that you're doing. Thank you so much for your time.